A very warm welcome to you, Doctor. So, to the audience, today we'll be speaking about the specialty, which is anesthesia. And Dr. Raksha, who has done her DNB in anesthesia, will be giving you a complete brief about how to, if you choose anesthesia as a specialty, what will be the benefits and what will be the drawbacks. So, a very warm welcome to you, Doctor, once again.
Thank you. Thank you. Thank you so much.
Doctor, could you please describe how is anesthesia specialty different from other specialties?
Okay. So first of all, anesthesia is a clinical branch. So we all know that for any surgery, anesthesia is a must and should. So this anesthesia, you will be studying about anesthesia in your final year MBBS. So it's not a major subject in your MBBS curriculum. In anesthesia, we have three, what I can say, there are three different divisions in anesthesia. One is the main anesthesia, what we practice inside the OT. Another is critical care. So we also take care of ICU and critical patients. And the third one is pain. So pain management, we run a pain clinic also. So anesthetists, they are in the OT, they are in the critical care, they are in the ICU, and they are also in the pain clinic. So these are the three sub branches of anesthesia. So overall we deal with these three branches. And it's like you're a kind of you are master of all but jack of none. So you will have knowledge about all the subjects, since you'll be dealing with patients with different disorders and comorbidities, and patients of extremes of age groups. So you'll be anesthetizing a newborn, and as well as you'll be anesthetizing a very old patient, say 90 plus also, and you'll be anesthetizing a physically handicapped or some chromosomal abnormality. So you will deal with all kinds of patients. It's not like you're fixed to one category of patient. So it's like and you're also surgical branches, so you'll be coming in contact with patients of varied surgical branches. So, and in critical care, apart from your surgical patients who require ICU care, you'll also be taking care of patients with trauma, patients with pancreatitis, those who require only conservative management and not surgical management. So basically you will have knowledge of all the branches of medicine, but it's not, you're not a master of you're master of all the branches but a jack of none. We're also known as perioperative physicians. So the our contact with patients will be minimum, unlike other branches like medicine or pediatrics, they'll have follow-up sessions and everything, whereas in anesthesia you will come in contact with patients only few days or a week prior to surgery. You evaluate them and make sure they are fit to undergo the surgery, and make sure they're fit to get anesthetized. Then you'll meet them on the day of surgery, as well as 3 to 4 days after surgery. So we are in contact with patients only for a limited duration of time, unlike other branches. And then and we also take care of emergency situations, like in casualty, if the patient needs some intubation, the patient has to be put on ventilator, or any patient needs CPR, we are called. If there is any code blue in the hospital, code blue is any patient having cardiac arrest anywhere in the hospital, anesthetists are called. Along with the few hospitals, only anesthetists are called, whereas in few hospitals, the emergency medicine department also will be involved. It's usually a teamwork. If there is a code blue in the hospital, it's a teamwork between the emergency medicine team and the anesthesia team. So basically, we are there everywhere in the hospital. So the importance of anesthesia, I think people have realized it during COVID. So we had to take care of COVID patients in the ICU. We were also anesthetizing COVID positive patients for any surgeries that they required on an emergency basis. And we were one of the frontline workers. And in one of the leading magazines of US, 1 month was attributed. I mean, 1 month. I think it was. I don't recall. I don't recall the magazine's name. So in one of the leading magazines in US, 1 month was dedicated to only anesthesiologists all over the world. So yeah, and you cannot secure a cannula. Patient needs cannula for infusion of drugs or to start a drip. They call anesthetist. So you need intubation. They call anesthetist. You need patient needs CPR. They'll call anesthetist. They are overworked. The intensivist, even medicine, post MD medicine also, you can do critical care. So if they are saturated or if they are overworked, they request anesthetist to take care of the critical care. So it's like we are required by everyone in the hospital.
Okay.
With very less recognition. We work behind the screens. So not many patients know what's the exact role of anesthetist, like how the credit goes to surgeons or the physicians. The same amount of credit the anesthetist will never get in any hospital.
Okay.
So you should be satisfied with that.
So, doctor, when it comes to the specialty, once the doctor will choose the specialty, what are the career opportunities? Like, there is something MD in anesthesia also.
And DNB, yes, definitely.
Yes.
So there is MD as well as DNB. So MD is what you do in medical colleges, and DNB is what you do in corporate hospitals, as well as in few government medical colleges. There are only very few government colleges that are offering DNB. Usually, DNB is what you do it in corporate hospitals. For both MD and DNB, you will have to write NEET exams, and counseling will be separate for MD and DNB. But the thing is, once you get an MD seat, sure shot you will get the degree. Whereas in DNB, the DN and MD is usually the board. The university will be the state university, so they set the question paper. They'll have, and during practical exams, there'll be one internal from their respective college and 3 externals from different states. Whereas in DNB, all over the country, the board is National Board of Examinations, New Delhi. The question papers will be set by the NB board, as well as the practical exams will be conducted by them. All 4 examiners will be externals. Prior to COVID, the exams were conducted, practical exams were conducted outside the state. But after COVID, it has during COVID and after COVID, it is being conducted within our own state and within our city. Most, like, I did DNB from Bangalore, so my exam center was in Bangalore, but all my 4 examiners were not from my hospital. And passing DNB is very difficult, and if you choose to do DNB, you have to be very careful and wise in choosing a very good reputed corporate hospital with good passing percentage. And I did DNB anesthesia from Manipal Hospitals, Bangalore. So it's one of the top corporate hospitals for DNB anesthesia. So you should be very sure that you should be very sure about the corporate hospital you're planning to take if it's DNB. Whereas in MD, it's not like that. It's very sure that you'll be getting the degree once you're done with MD, because exams are not that tough compared to DNB. DNB, first you'll have to submit your thesis. So if it's a 3 years course, within 2.5 years of joining, you'll have to submit your thesis. Then after 2.5 years, you'll have your theory exam. Once your thesis is submitted and it's accepted, you'll be given hall ticket for theory. That is after 2.5 years of joining. Once you've cleared your theory, then you'll be allowed to write practicals. So it's like that. Practicals will be after 3 years. So if you fail in practicals, but you've cleared theory, you will have 3 attempts for practicals. Even if you don't clear those 3 attempts of practicals, you'll have to write theory again. Whereas in MD, it's not like that. You'll be giving theory and practicals together. There'll be a gap of 10 days. Unlike in DNB, wherein you'll have to wait for 6 months between theory and practicals. It's not like in MD, you have to, it's in MD, there is no fixed rule that you have to clear theory and then you will be allowed to write practicals. It's together. Whereas in DNB, you have to clear theory to give practicals. Unless you clear theory, you won't be eligible for practicals. So it's like that.
So, doctor, what is like the career opportunity? for if any doctor does the MD and or do the DNB, do they have the same career perspective when it comes to the jobs in the hospitals, whether it's government or a private?
See, if you're planning to join a medical college, definitely MDs will be given a upper hand. But now, according to the latest NMC rule, it says that if you've done DNB from a more than 650 bedded hospital, you are considered equivalent to MD, and you have to do 1 year SRship. Like how MDs are required to do 1 year SRship. That is only if you do DNB from more than 650 bedded hospitals. So once you do MD, once you've done with MD, you can join medical college or any corporate hospitals. But you've done DNB, if you've done it from a hospital less than 650 bedded hospital, and then to join medical college, then you should be ready to do 3 years of SRship. That is what the NMC guidelines say, the latest guidelines says. So 3 years you have to do. But if you want to work in a private sector like a corporate hospital, MD or DNB doesn't make any difference. But if you want to join a medical college, make sure you do DNB from a more than 650 bedded hospital. Then you'll be considered equivalent to MD.
So, doctor, when it comes to the life balance, like career and work balance and other opportunities in this field, could you please give an light of this, like how the work-life balance is and how the other further career opportunities are there in this field?
See, career opportunities like post MD or DNB, you can write super specialty entrance exam, and we have options like DM critical care. You can choose DM critical care, but now from the last 2 years, the syllabus has changed. Like you have to study medicine if you have to. If you want DM critical care, then you'll have to study medicine apart from anesthesia. But whereas if you want to do DM neuro anesthesia, there is DM pediatric anesthesia, DM onco anesthesia. There are fellowships also, pain fellowships. One Kolkata, in Kolkata, there is Daradia Institute, which gives you a pain fellowship. There is pain fellowship option. Onco anesthesia is there, and critical care fellowships also you can do. If you don't want DM, if you don't want to study for 3 years again after MD or DNB, you can do fellowships which are only for 1 year post your MD or DNB. 1 year of IDCCM, that is Indian Diploma in Critical Care Medicine. That is 1 year. You can do it in any of the corporate hospitals which are providing IDCCM, or 1 year fellowship in pediatric anesthesia, neuro anesthesia, onco anesthesia, pain fellowship, and obstetric anesthesia. And there's also regional anesthesia fellowships. So there's one website called AORA, Association of Regional Anesthetists of India. So in those websites, you can see there are a list of hospitals that are providing regional anesthesia fellowships. See, career options, it's like, see, once you're done with MD or DNB, it's not like the job is served to you on a platter. As soon as you enter a corporate hospital, you'll be allowed to handle all sorts of cases, high risk cases. No, you slowly have to establish yourself. It will take 1 year to 2 years of time, because you'll be dealing with patients, hemodynamics, the physiology. So the seniors of those respective hospitals, they'll assess your skills. Once they are confident that yes, you can manage any sort of case, then you will slowly, you will start getting better cases. So those glitches are there. I think that's there in every field. No, I don't want to be in OT. Then you can choose to do IDCCM or critical care fellowship. Then you can be only in ICUs, and you have plenty of opportunities for critical care. You can. There are lack of intensivists all around the country. So post MD, 1 year of fellowship, you can easily get critical intensivist job, ICU jobs. If you're hell-bent on being inside the OT, then you have to take baby steps. As soon as you come out of the college, as soon as you get your degree, it's not like you will easily get the job. And work-life balance, yes. If you join a medical college, you'll have a fixed timings. There'll be government holidays. Sundays will be holidays. Actually, even in corporate hospitals, Sundays will be a holiday and government holidays will be there. But in corporate hospitals, the caseload will be too much. Sometimes they will require more anesthetists, except for those who are on duty. They might require two or more helping hands. That time you'll be called. But see, I don't think only in anesthesia it's difficult. Everywhere you'll have to maintain a balance between your personal life and professional life. Usually on Sundays, the OTs don't run anywhere, as far as my knowledge is concerned. So weekly one off is there, and you will get a post duty off. So if you have done a 24-hour shift, definitely there'll be an off next day. So earning wise, you'll have a fixed pay initially. If you have to become a consultant in corporate hospitals, few hospitals, they require you to do fellowships post MD, and you should have a working experience of at least 6 years. That is what corporate hospitals they require. But few corporate hospitals, they take you in as registrars. So 2 years or 3 years of registrar experience will promote you to be a consultant. It's like more work and less pay. But that's how our field is. Somewhere or the other, you'll have to compromise. To gain experience, you'll have to compromise with the low pay. So it's like that.
So doctor, how is like patient handling in this field? Is it as difficult as other fields?
See, you should be very vigilant. Once you're inside the OT, you're starting to anesthetize the patient till the end of the surgery. You should be very, very vigilant, because you will be dealing with the physiology of the patient. Basically, you're the captain of the ship then. The surgeon just blindly operates on the patient without noticing how's the heart rate of the patient, how's the BP of the patient. You are there as the captain of the ship, managing the ship there. So you have to be very vigilant. It's mentally stressful. Sometimes, yes, physically stressful. The dosage of drugs, you cannot make any errors in calculating the dosage of drugs. Basically, there should be no errors from your side. You should be as careful as possible. Yes, sometimes errors do happen. Human tendencies is to commit mistakes. But in anesthesia, we have one advantage of anesthesia is inside the OT, there are no ego clashes. Inside the OT complex, no ego clashes. You're not able to handle the situation, you immediately call for help. Your colleagues, be it seniors or juniors, they will definitely come running to help you out. So that's one of the biggest advantages of our branch, I can proudly say. So any help, there is no ego clash. You will definitely get help at any point of your time. That is in a medical, especially in a medical college, there'll be lots of helping hands. So any tough situation, you can discuss with the seniors. I've got a case, so and so. I'm a bit confused as to how to handle this case. What are your suggestions? In a corporate hospital also, you will definitely get those helping. There are people to help around. So in our branch, we have no ego clashes. No, she's senior to me, why should I call her? She's junior to me, why should I call her? No. Ship is sinking, you'll have to call for help. It's like that. So, and they're always there to help.
Okay. Thank you so much, doctor, for answering all the questions. Do you want to give some last message to the doctors once they see the video?
Oh, definitely. All the best for your NEET exams. Prepare well. Don't worry about the branches as much. Just focus on doing well in your NEET exams. Once the ranks are announced, maybe you can think about it. Don't be don't pressurize yourself that you want to do this, take up this branch, that branch. Just for that moment during preparation for NEET, just keep aside that thought of branch and just focus on studying. And all the best once again. Choose wisely, make your decisions with no regrets later on. Your decision should be in such a way that you should not regret that you've taken that you've chosen that branch, or why did I even choose this branch? I happily chose anesthesia. In fact, I wanted anesthesia from the very beginning. So I wanted to stay away from the patients as much as possible with minimal contact. So make wise decisions. All the best once again for your exams.
Thank you so much, doctor. Thank you so much for your time. We'll collect all the questions from the participants if there are any, and we'll update you about that.
Okay. Thank you. Thank you.
Thank you. Thank you so much, doctor.
Okay. Bye.